My name is Jane Powell. Welcome to Community Connections, brought to you by the Greater Kanawha Valley Foundation. This is a show showcasing community involvement. We've got a great guest lined up, and I can't wait for you to meet her. Merinda, welcome to the show.
Thank you for having me.
Merinda Stricklen, you are the director, I'm going to read it so I get it right. You are the Director of Health and Community Education for FamilyCare Health Centers.
Yes. I am.
Well, I want you to tell us about FamilyCare, and I want us to kind of narrow down to some of the great programs that you're doing. But first, what is FamilyCare, for those that don't know?
So FamilyCare is a federally qualified health center that has been serving West Virginia for over 35 years. We operate 21 brick and mortar locations and have 5 mobile units across 4 counties.
Wait, how many?
4 counties.
Wow.
So, yeah, those counties are Kanawha, Putnam, Boone, and Cabell.
Okay. Busy group of folks.
Yes, we are, yeah. So last year, in 2024, we served 44,540 patients. So we serve a lot of people across those locations.
Yeah.
And, we have a lot of people with chronic diseases. So 11% of those patients had diabetes, 23% had high blood pressure, and 47% were living with overweight and obesity.
Well, I'm so glad they found you.
Yes, I am too. Yes.
Yeah. So, great organization across 4 counties. What makes FamilyCare stand out?
So I think something that really makes us stand out is that we really focus on providing whole person care. So we want to reach patients across counties, across populations, across income levels, and we have newer departments that we've been developing. So one of those is the Health and Community Education Department. And so with that, we really focus on figuring out what are the barriers that prevent patients from being healthy. And so I think that's really important. As a health center, to focus on those things, it's important to provide education services that help patients be healthy. I think so many times we focus on just giving the patient a medication, but there are so many things that go into health, and that can be not being able to afford healthy foods, not accessing medication, not having transportation. And so I think all of those things are really important, and that's really what drew me to FamilyCare. I'm a physician assistant, so I practiced for over 20 years and got really frustrated with not being able to really impact the health of a patient in 15 minutes. And so I chose to pursue a master's in public health and really wanted to change population and really improve West Virginia's health. So that's what brought me to FamilyCare, and we started the Health and Community Education Department. We also, at FamilyCare, have the only freestanding birth center, and we just recently started a foundation so that we can be able to get funding for other special projects and just fulfill our mission. So I really think they're very innovative in what they do, and that's really special.
It's all for another show, but I did have a chance to tour the birthing center. It's very nice.
It is beautiful.
Yes.
Very nice.
But your department, you have a little acronym that
Sure.
kind of sums up the high points of what you guys do, right?
Yes. So it's a very long title, Health and Community Education. So when I first came, people were like, what is it? What do you do? So we decided to make this acronym so people would know what our mission and purpose are. So the health stands for transforming health outcomes, and that's really the bottom line. That's what we want to do, is really help patients be healthier. The A is assessing and addressing root causes of poor health. So those are the things like not being able to access healthy food or medication or any of those things. C stands for communication. Community. So we want to develop community across patients, providers, associates, our families. It's really important that we build this community. And then the E is eliminating those root causes through education and programming. So really focusing on that education piece to help people be healthier.
So HACE.
Yes, so HACE is what we call it for short.
Okay.
That's right.
So under all of that, HACE, you have a few programs. And so let's talk about the Prescribing Better Health program.
Yeah, so Prescribing Better Health is a food card program that we offer. So patients get a preloaded debit card. It's called a Fresh Connect card. It's actually provided through a company called About Fresh in Massachusetts. We've been really excited to partner with them.
Nice.
But this card, so it provides $50 every month to patients for 6 months. And they can purchase any fresh fruits and vegetables at any Kroger and Walmart nationwide.
Wow.
So that's beautiful because it's all fresh fruits and vegetables. We know it's healthy. It's going to make them healthier, improve their disease states. And so it is offered to any patients of FamilyCare who have a chronic disease or have difficulty affording food. So we're really excited to be able to offer that program.
Yeah, it's amazing. So they take their Fresh Connect card
Mm-hmm.
and they go to the grocery store and they get some vegetables.
Yes.
Well, what do they know? They don't know what to do with them. What do you do?
So, and that's where the education piece comes in.
What about asparagus? I mean,
Yeah,
it's
right,
pretty, but
exactly. How do we cook it?
Yeah. So
Yes.
what happens then?
Exactly. So that is one of the big things of the program is that, so it's not enough to just provide food. We also have a nutrition component. So as part of the program, they have to do one of 3 things during that 6-month period. So we have a dietitian, Angel Cunningham. She is wonderful. She sees patients for individual nutrition sessions, and then she also does cooking classes. So that's another thing that they can participate in is doing our cooking classes, and we do those at West Virginia State University. So people really love our cooking classes. They have so much fun, and we teach them what to do with those vegetables and fruits. And then the last thing they can do is we have an online app that provides nutrition, recipes, and education. So,
Wow.
yeah.
Now let's go back to these cooking classes. I'm excited about this.
Yeah.
So it's at West Virginia State. I
Yes.
guess they have a
They have a
kitchen
demonstration
there
kitchen. Mm-hmm.
that you can use. And so you're cooking the vegetables. Where do you get your ideas? And I'm just so excited about it.
So
Tell me
yes,
more
so
about
Angel
it.
does great with the classes. So Angel actually, the majority creates her own recipes. So
Yeah.
she makes the recipes that she does at her house.
But she's a registered
And
dietitian.
she is a registered dietitian, so very knowledgeable about my plate and all of those things.
Right.
And we love her recipes because they're very good and they're easy, and that's what she said. She wants to be able to only spend 30 minutes in the kitchen very fast. So they're quick, they're easy, they taste good. Patients actually have talked about how they continue to make them after the class. So a lot of our families are continuing to make the recipes going forward. So it's been wonderful. The patients love it, we love it. It's so much fun.
You're having fun and you're learning, right?
Yes.
And you're getting good food.
Yes, it is great food.
It's a
yes.
trifecta.
Yes, it is, definitely.
Which ultimately makes the patient healthier.
Right, exactly. And that's what we're going for, right?
Yeah, that is exactly
Yeah.
it. Tell me some other things that are happening.
So with the Prescribing Better Health program, we also have another program called Healthy Neighborhood, and that also provides healthy. It's another food card that we give to patients, and they can purchase healthy food. So that's Dollar General, Kroger, and Walmart. So we have 160 patients in that program, and that was a partnership with Vandalia Health and Highmark Health. So I'm really excited about that. Prescribing Better Health is actually a partnership between 2 foundations, Greater Kanawha Valley being one of them, and then another insurance company. So we've been really happy about those partnerships. That's what has helped us to be able to accomplish these things. Mm-hmm. We also offer food boxes and hygiene kits for our patients at locations. If a patient comes in and they don't have access to food at the time and they need something, we're able to give those. That also is provided through the Greater Kanawha Valley Foundation. So that's been beautiful.
Almost tied you over boxes, so to speak.
Yes, and so then what we do, so with that, once we give them a food box, then our department contacts them and tries to get them into the Prescribing Better Health food card program so that we can give them a longer source of food, and we also try to get them connected into SNAP and Medicaid so that they're able to, we're able to provide for their other needs because, the food's going to go away, but when we get them into the government assistance programs, it provides more support for them.
So it's just another example of that whole body, whole patient care.
Exactly.
And
yes.
That is, again,
and that's
so
really
important.
what we do. So yeah, we get them involved with the social workers. If they need dental, Angel's wonderful about that. If they have a dental need or a vision need, she'll refer them to the other providers so that they're able to do that.
Yeah, so. Wow. What makes it so successful?
So
I'm guessing your passion.
Yes, I think that is one of the things. But I would say, one of the biggest things is that we really create programs based on what patients need. So when I first came to FamilyCare, I went around to every location and asked the providers and medical staff, what do your patients need? And so we really try to figure out what are those barriers, and then we create the programs based on those barriers. So it's things that are going to eliminate the barriers. With Prescribing Better Health, patients are able to go shop at any time. They don't have to come to a location at a certain date and time. And so I think that eliminates that barrier, and it's easier for patients. They can go shop. They can choose what fruits and vegetables they want to purchase, which gives them autonomy and makes them more likely to eat it. And patients have expressed that they've been eating more of a variety of fruits and vegetables because they don't have to worry about the cost. And I think we're meeting their most basic need. And when you do that, like, patients are just so appreciative of what they're doing. We actually had a patient that said, FamilyCare feeds me. And so it's just really neat as a health center to be able to really, that we're helping, we're making a difference in these patients, and they know that. We receive referrals across all the locations for our food card programs. Patients really, if the word is getting around, I get cold calls on my phone. Can you please tell us about the food card program?
Well, that's a good point. So if people are interested in learning about the food card program, the cooking classes, or any of the other services, medical services that FamilyCare, they can, first place is probably the website, right?
Yes.
And that is familycarewv.org.
Yes.
I think we have that on the screen. Or you can call a phone number, which is 304-760-6336. So either of those ways will connect a caller or a to FamilyCare.
Yes.
And then they can look for services or get connected. If it's a phone call, they'll connect them to the right area.
Yes. Yep.
Yeah.
In addition, we also do nutrition education classes. So we partner with West Virginia State University and WVU, their family nutrition program, to also offer other classes. Angel sees patients, so she's limited on what she can do. So we are able to partner with other people, which has been really good as well.
Do you have, you referenced a patient that told you you feed them, but can you tell me another story? Have you seen people's lives change, lives improve because of what they're doing?
Yes, so definitely. We have multiple patients that have said, had we not had this food card, our family would not have been able to eat. So that is something we get a lot. I actually just recently talked to a patient that was enrolling, and she was really appreciative. Her husband had died of cancer, and her son was autistic, had a strict palate and very picky about what he ate. And she said, I'm so excited about this because he's going to be able to pick different fruits and vegetables and be able to eat them. So we do. Angel has significant improvements in weight loss for patients, decreasing their hemoglobin A1Cs. So we are seeing that health outcome improvement in addition to them being able to access the healthy food. All of those things are happening, which has been beautiful. So currently in Prescribing Better Health, we have 195 patients enrolled in that program, and that's been since November.
Wow.
And they have spent $15,877 since November in fresh fruits and vegetables.
I love
So
that.
I think that speaks for itself.
Yeah.
That we've been able to do that through all of our food access programs in 2024. And since 2024, we have reached 355 patients providing healthy food to patients.
Wonderful.
So, yeah, definitely, all those improvements, the health outcomes, and just them being able to afford healthy food, which, that also takes away the stress of worrying about food.
Right, which is a whole
inflation
other
costs.
level of healthcare.
Yes.
Right.
Yeah.
So your department is busy. FamilyCare is busy. Everyone in the health field is busy, really. What are you most proud of?
So I'm most proud that we've been able to reach all of these patients and provide food to patients, because I think when you meet the most basic need, you're really making a difference.
I think you're taking care of the whole patient.
Yes,
and that's what's so
exactly.
important.
Yes.
Merinda, thank you so much for being here
You're
today.
welcome.
I love learning that you are treating the whole patient. I think that's so important for everyone.
Yes.
And thank you guys so much for being with us. This has been Community Connections, brought to you by the Greater Kanawha Valley Foundation. We'll see you next time.